What's really unique about ScoliCare is we use computers now to gather the information to get to an engineer, then also the doctor's information on as far as what the goals are, pain levels, how stiff the spine is. And then the engineer can custom make a brace so we can make sure the patient gets a perfect brace for them. And then we get it manufactured using computer technology and then sent to the patient. So that's one of the great things about ScoliCare is we take out a lot of the human error.
Hello and welcome to the Posture Dojo podcast. My name is Sam Miller. I'll be your host on this postural transformation journey, sharing some stories from my own healing journey of an 85-degree hyperkyphosis scoliosis and speaking with experts from a variety of fields, some you might expect, some that might surprise you, and some that are bringing together experts from a variety of fields, which is very exciting to me and very important for somebody who is faced with the challenge to prevent the progression of a curve and correct the compromise in a spinal curve. It requires a holistic viewpoint, in my opinion, and we're seeing the modern conventional medical system move in that direction. And today I'm excited to have Dr. Chris Gubbels on the podcast, who sounds like is doing exactly that, based in Denver and Colorado and other locations. He's from ScoliCare. Dr. Chris Gubbels, welcome to the podcast.
Thanks. I'm excited to be on here. It's the first time I've been a part of a dojo, so this is good.
So you mentioned that ScoliCare is the leading authority in non-surgical alternative scoliosis and kyphosis treatment methods. Is that accurate? And can you describe how you approach this?
Yeah, I'd say ScoliCare is definitely the or one of the leading authorities in both education, research, and the non-surgical treatment of scoliosis and hyperkyphosis.
Amazing. And so you've summed up knowledge and research from different areas. How would you describe your approach to scoliosis? And I guess by age is going to be a different approach, but walk us through how you perceive the correction.
I mean, ScoliCare's mission is to get patients the right treatment at the right time. And so we know every person is different. So all the treatments have to be custom for the individual patient. And so the first thing is just evaluating to see what's going on, the risk of progression, determining what treatments are the most appropriate. And all of our treatments, follow guidelines that have been established by SOSAR, which is the International Society on Scoliosis, Orthopedic, and Rehab Treatment. Basically, it's the international organization that really evaluates what treatments do we know are the most effective for different types of scoliosis or kyphosis. And so all the treatments we do in our office are based around custom bracing, either for scoliosis or hyperkyphosis, or sometimes scoliokyphosis, and scoliosis-specific rehab. And we use a method for rehab called Scoli Balance that pulls from different scoliosis rehab methods, including Schroth and C's and chiropractic biophysics, and combines those to take the best aspects for each individual case. So it's all custom, but mostly it's combining bracing and scoliosis-specific rehab.
Where are braces at in 2024 in a treatment protocol?
Can you clarify when you say where they're at? Like, how do you mean?
I've seen from a distance that they've been evolving in terms of the customization ability, and they've started pretty basic and they've gotten quite advanced now and custom molding. I'm just wondering, what is the tech in terms of bracing at the moment?
I mean, it really depends on where you get a brace, because different places, their method of how they design and make braces are different. And also the goal of their braces are different. For example, most braces use something called 3 points of pressure, where they're literally trying to squeeze the spine, and by doing that, trying to reduce the size of the curve. And it's almost like you're putting on a cast, and really a lot of times the goal there is to hope the curve doesn't progress to surgical levels, sometimes reducing the curve. The other thing, a lot of braces that are made, especially the ones that a lot of times are still made at orthopedic centers and hospitals, a lot of times they're designed using old methods, meaning you may have someone called an orthotist, who's someone that makes orthotic devices, that may or may not have a lot of training in scoliosis. A lot of times at a hospital, they're not as trained because they're treating a lot of other things too, but they're using their individual hands to make measurements and design a brace. And so if you went to 10 different hospitals, you may get 10 different braces for the same scoliosis, because it just depends on the person's individual skills and how he wants to design it. But what's really unique about ScoliCare is we use more computer aided methods to take out the human error in how we design and make braces. And so we use something called a structural scanner, which basically takes 3D images of a person, and we take their x-rays, and then we can send those to an engineer, and then an engineer will custom make the brace for that patient, not just based on their curves, but also based on the goal, whether it's to reduce pain, stop progression, or try to reduce the curve. Also, how flexible or stiff the patient is or the spine is, because that's going to make a difference in how aggressive a brace is going to be. So, we use computers now to gather the information to get to an engineer, then also the doctor's information on as far as what the goals are, pain levels, how stiff the spine is, and then the engineer can custom make a brace so we can make sure the patient gets a perfect brace for them. And then we get it manufactured using computer technology and then sent to the patient. So that's one of the great things about ScoliCare is we take out a lot of the human error. I always tell patients, and that's one of the brilliant things behind Dr. Jeb McAvinney. He's the founder of CEO. He got trained in a lot of different bracing methods, and he found there's a lot of good things, but there was flaws in a lot of methods. And one of the biggest flaws is the human error. If you have 10 different people make a brace with their hands, you're going to get 10 different braces. So he's taken that out of the equation so we can help ensure the patient's going to get the right brace for them. The other thing with ScoliCare is we're not really trying to squeeze the spine. We're working to untwist or unwind the spine. So we say the brace that ScoliCare uses actually puts the patient in a corrected and sometimes an overcorrected position. If it's like someone that's young and flexible and growing, we're not just trying to push on the spine back straight. We're trying to untwist and unwind.
Amazing. Okay. So on the subject of braces, there's been a couple things that I'd love to run by you in terms of how I think about it. Some people, let's start with this. The number one selling posture correction device on Amazon is those posture braces, those ones the black straps that you can strap in and they just pull your shoulders back and create different types of tensions and issues. Personally, I'm not a fan of those. And then in the scoliosis and kyphosis, when I have a severe imbalance higher up, my body has naturally formed a brace and without even knowing it. And that's when I ran into issues at 33 because my hips and psoas were so locked up from just in this constant state of maintaining this imbalance. So my body had formed essentially a natural brace to hold this compromised structure. So there's also that when it cut like that effect. And then I'm like, when we're applying a brace, are we also learning how to breathe and build those muscles in our body that are designed to help us brace our natural posture? Does that come along with these custom bracing? So that's where my head is at around bracing. How does that kind of fit into that? And do you apply these types of things along with the brace?
Yeah, I mean, on the first one, the first brace you talked about, that's just more the off the shelf suspension brace. Those are designed more for someone. They may help if someone just has a postural issue, but posture and a true hyperkyphosis where you have bone deformity is completely. Those are two different things. There's times maybe those could be beneficial, but for someone that's got a true hyperkyphosis, or they have a hyperkyphosis that is beyond 60 degrees, that's not the right tool for them. And then as far as what you were talking about, where your spine creates its own brace because it gets stiff, your body tries to protect itself, which is where you have to really customize a brace. Because if you were 17 years old or 16 or even a real young adult that's really flexible, you may be able to reduce the size of that kyphosis. But as your spine gets stiffer, that's a prediction of how much the spine can actually change. So if someone has a really rigid thoracic spine and you were making a brace, you'd be more making a brace to help stabilize them and keep them from collapsing versus trying to correct. And what happens when you're done growing, I always tell patients when you're done growing, it's different than when you're growing, but you're basically getting this tug of war with gravity. And as gravity pushes down, people like to hunch over and collapse more and more. And the idea of a brace to be worn part-time, not like when you're growing, is to keep you upright and keep you from collapsing and give your body a chance to relax and recover. But they should be combined with specific exercises and rehab. And so the best results come when we do bracing when appropriate. Not everyone needs a brace, but we combine those with scoliosis specific exercise and rehab. And that includes rehab for hyperkyphosis. So you incorporate things like corrective breathing when appropriate. You incorporate things like neuromuscular re-education, where you're teaching someone and retraining their body to hold itself in a more correct position. You're strengthening and stabilizing them in a correct position. So we want to combine those to get the best results. Hope that
Amazing.
answered your
Yeah. I mean,
question.
is there any particular exercises that you're a big fan of that you want to get more people out there doing with a let's say hyperkyphosis?
You know, I would say, because a lot of times they're specific to the spine and what's going on. The number one thing that we see, and pretty much everyone can apply exercises that include elongation. Because if you have scoliosis, your spine's twisting and you're losing some height. If you have kyphosis, you're hunching over and you're losing height. So when we're doing the corrective exercises, everyone can benefit from learning to elongate their spine. And then if there are and then also expanding too in the body, doing exercises that increase expansion. And sometimes you'd have to have someone that's trained to teach you how to do those. But those are pretty general things that anyone that's doing rehab, those are generally the first steps, teaching someone to elongate and then also how to expand. Because when you have a scoliosis or kyphosis, you collapse.
Amazing. Yeah, I mean, that's why the protocol, the method that I'm developing, that I use myself, that, is a collection of everything that I'm learning, is called the Height Maximus
Mm-hmm.
Protocol. And it started when I was doing some of these elongation exercises on TikTok, and it was how to get taller, and it
Yeah.
was like, you can't get taller, you can't get taller. I'm like, if you have an 85-degree curve in your spine and you're collapsed and you're just naturally letting yourself collapse and you're not doing too much about it, you're not breathing as deeply as you could, doing some of these exercises, you can actually increase your height. And I increased my height just under 2 inches over the course of a year or two.
Oh,
Yeah.
wow.
I mean, that was at 33 when I'd just been living with it. And the issue was that I didn't know that I could do so much about it. And I was just ignoring it
Mm-hmm.
and living with it pretty much until I was 33, when the midsection was so choked out, so compressed, that it started literally choking me out. My lymphatic system started shutting down, circulation, digestion, all my systems were just being choked out. And it was because of that.
What's interesting too, when we have someone's spine that we believe can be improved or we can reduce the size of the curve, one of the things we can look at is an in-brace correction in height. So if their spine can be improved, you will see an increase in height with the brace off versus with the brace on.
Hmm. Okay. All right. And that's when they're in the growing years or after they've grown? Yeah.
Even after a lot of adults, you put them in a brace, you'll see an increase of height, the half an inch, quarter inch, depending on how flexible their spine is. But it can tell you with if the brace is one has a chance to reduce the size of the curve, just if they have a change in height with the brace on. If they're hunched over, they're going to be less hunched over. If their spine is twisting and it's untwisting, you're still going to see some recovery in that loss of height. But if the spine is real stiff, those could be a
Mm-hmm.
little bit different.
Yep. And so, yeah, achieving maximum height with the least amount of effort, I think, is a shared goal for everyone, regardless of what particular compromise they have in their posture. So, you mentioned that you're bringing together professionals from a variety of fields for treatments in your own clinic, but then you're also about to speak to a bunch of chiropractors. So, I'm curious, what are you going to be sharing with them?
Yeah, I mean, so first, like ScoliCare, I think is the only organization I'm aware of, at least, that combines physical therapy for scoliosis along with working in with chiropractors. But they're chiropractors that are very specifically trained in biomechanics and bracing, but combining those under one setting. But when I'm speaking to other chiropractors, the big thing we are teaching them is how to detect and properly evaluate scoliosis and when to refer out. And also, we teach them what they can do and what they can't do, and a lot of it's education because people don't the average patient doesn't realize in chiropractic school you learn a little bit about scoliosis and physical therapy, maybe a little bit if any, and then if you're a general practitioner you probably know you have very minor training. Even a pediatrician has very minimal training in scoliosis. So a lot of times we're educating them, we're teaching them what to look for, we're teaching them how curves can progress, when is it appropriate to refer, like which treatments can do what. And when someone has scoliosis, I believe there's a role for chiropractic and general physical therapy or Pilates, yoga, because those things are good for the body. They can help reduce pain, they can increase mobility. But we know those things on their own are not going to impact how a curve may progress over time. So when I'm teaching to the doctors, we're educating them, we're teaching them how we can work together, and we're teaching them to make sure their patients get the right treatment at the right time, because that can be the difference between someone that ends up having surgery and not having surgery. Because what we don't like to see is someone's, oh, they have a curve, it's small, I think I'll just do my adjustments and manage it. And then all of a sudden you get that, oh shit moment where, wow, this has gotten really big. Now I should refer out, which is better than not referring at all. But ideally, we get the cases or patients that come in when their curves are smaller, because then the earlier we get the right treatment, the more likely having a successful outcome. So that's literally what we're teaching, educating. And we also teach them to, in this talk, I'm going to be talking about red flags, because 20% of cases are idiopathic or 80% are idiopathic. But what about the other 20%, the ones that could be caused by underlying neurological condition or something like Marfan's disease or like a tumor or something? So we teach them all of the other things. Hey, if you see these, that should get your attention, that there's a increased likelihood there's other pathologies that could be causing the scoliosis too. And then we're also going to go over some myths. And there is a lot of myths and misinformation about scoliosis. One of the big ones is some people just assume if I go to the hospital, that's the experts and you're going to get the best treatment. And I can tell you 100% that we see a lot of mismanaged cases. And I'm going to be showing some cases from our local, like the biggest hospitals around in Denver, where people have x-ray series or 5 years and they were just told to watch and wait. And we've seen curves go from 15 to 20 to 30, and now boom, surgical, and like nothing was done or recommended. So we're going to teach them about how do you know who's the best place to go, things like that. A big myth is people think that just because you do bracing, you're going to get muscle atrophy. And we know ScoliCare just published a study where we looked at adolescents that were growing that were wearing Scoli brace and doing Scoli balance rehab, and 100% of the people had an increase in both trunk abdominal and erector muscle strength and endurance. So we're going to go through some myths to help shine some light on what the truth is in treating scoliosis properly and kyphosis.
Let's wait and see, says the surgeon. And the
Wait and see is not a treatment, right? It's wait and see is basically telling a parent, oh, there's something going on, go home. If you notice a change, let us know. Now, observation can be a treatment in smaller curves where you're proactively doing checkups and evaluating every 3 to 6 months. But that's watch and wait or wait and see is, oh, let's just see what happens.
So what would you say to that patient if you were the doctor? You're the orthopedic surgeon, they're not eligible for surgery, and they're a prime candidate for a non-surgical alternative treatment, and maybe they don't have a ScoliCare, your services around, which the grand majority don't, realistically. So what would you tell that patient
Right.
in that moment to get them on the right journey?
First thing I tell them is, look, all big curves start off as small curves. So we're not just looking at where it is today, we're looking at where it could potentially go. And when it comes to something like this, you have to find someone that really knows what they're doing. And that may mean traveling. We have people that travel from different states all the time, and then we can treat them and manage them from far. So it's not just about where it's the most convenient or closest. It's about getting the right treatment and doing the right thing at the right time. Those are the keys for success. Because you could do treatment right away, but if it's not the most effective or the right treatment, if it's something that's not shown effective, it doesn't really help. Or you could have a perfect treatment, but if you don't do it when it's needed to be done, you still don't get the result you want. It's like making a cake. You could have all the ingredients, but if you don't use the right ingredients in the right order at the right time, you don't get the result you want either.
And how do you define the right, effective, proven treatment today?
So I think you can go to SOSORD. There's some papers published where there's generally a range of acceptable treatment that can be anywhere from just observation to surgery. But for different degrees of curves at various growth stage, there's generally a guide that gives people a range of the most minimal treatments to the most aggressive treatments that would be considered appropriate. And then a lot of that comes down to the patient's goals and then also the provider's recommendations they're working with.
Okay. I'm curious what your perspective is on the psychosomatic perspective in terms of looking at why the spinal cord might be proportionally shorter in those people in those adolescents with scoliosis. What
We don't dive into a lot as far as psychological aspects that could be causing their scoliosis, but we know there's definitely a huge psychological aspect for someone having scoliosis and also in their treatment. For example, when we look at adolescents or teenagers that are growing, the number one reason they want to do something is because they want to improve their appearance and how their appearance affects their self confidence and how they feel about themselves. So there's definitely that aspect of understanding how having scoliosis or hyperkyphosis impacts someone's own mental health or psychological well-being, and understanding that a lot of times that's the biggest motivator for doing treatment. The other thing we have to look at is the potential psychological impacts of doing treatment. For example, I mean, if you we have a lot of teenagers that wear braces full time, they do great, they don't have issues with it. But then we have some that wearing a brace, or they're going through school, they're in that age where they're interested in boys or boys are interested in girls and having to go to school and wear a brace. Some of those, it can be like a big mental or emotional burden on them too. So you really have to be aware of that when you're working with patients, and also realize you're treating the person in front of you. And if you have someone that like absolutely refuses to wear a brace, doesn't want to wear a brace, it's going to be a big psychological burden. The family's not on board. You really have to consider that if you're going to recommend a
mm,
brace.
mm-hmm, mm-hmm. It's for me, I certainly like I know in my situation certain neurological patterns, and seeing those neurological patterns in others, I would at least hypothesize that many of these compromises and collapses do have a neural kind of base or root to them as some type of nation. It's certainly there in how I approach it, and then I think about, in order to stand tall and straighter, it does have to have this confidence. You can't be thinking negatively and depressed and or anxious or protective or fearful. You can't have this traumatically ingrained fearfulness deep inside and then stand tall and proud and open at the same time. So certainly in the way I approach it, I do integrate a lot of that. Um,
Well, right on that topic, if you ask someone just to think about something that makes them sad or depressed, you're going to see them hunch forward. You're going to see their head down. You're going to see their shoulders roll forward. And then if you ask them to think about or focus on something that excites them, a moment where they were really proud, they accomplished something, you will just see them stand tall. You'll see them roll their shoulders back and their chest up. So we know your physiology impacts your psychology, and your psychology impacts your physiology. They're 100% linked to those. And so that's something you're talking about. If someone, it's pretty hard if you're if you put a smile on your face and you make yourself smile and stand up and have a good posture, it's difficult to feel like down and depressed.
100%. 100%. I do think that is I do see more of the industry integrating that in that more psychosomatic approach to this. And it's pretty exciting for me. I'm curious, what has your excitement or curiosity looking into the future of treatments coming down the line, especially because you're already starting to integrate some technology into the initial mapping, the 3D mapping of the body for the bracing? Are there any types of tech that you see coming down the line that you've got your eye on?
It's interesting to say. I would say one thing I know that ScoliCare is looking at is how we get the braces manufactured, and down the future where we can get braces made faster in in locations that are closer to clinics versus having to go to just one manufacturing plant. And that has to do with the possibilities of potentially using 3D printing. There's some issues with 3D printing now, making braces just based off how 3D printing works. But the ability to have centers where braces can be designed and made that makes it easier for patients to get a brace faster is something that's exciting. For example, if a patient's traveling from a different state, the idea that they could come, get evaluated, get a scan for a brace, do some scoliosis rehab, and potentially have a brace in just a few days for them so they can do that all on one trip That's an exciting just from a burdensome and economical standpoint. So making it easier for patients to get treatment.
I'm 39 right now. I'm pain free. I can do whatever activity I like. I'm living a full, happy life. I know in 20, 30, 40, 50 years, my gravity is really going to start taking a toll. I've always wondered what some type of wearable brace could look like, and some type of wetsuit with some type of AI tech that understands my posturing, can provide some support where I need it, and even help elongate and unravel gently at the pace that I needed to. It's monitoring my breathing even. I'm waiting for that tech to come down the pipeline, and I think in that time frame, it might just happen.
Yeah, interesting. I mean, things are changing every day. So
Who knows? Walk us through what your current kind of treatment protocol looks like. I mean, do you offer remote as well? And then if it's in person, if someone's traveling in, what's the time frame they would need, and also what costs can they expect for a treatment like this?
So the first thing we do is we have to do an evaluation to see exactly what they're dealing with from a spinal standpoint and what the best treatments are. When people are coming from long distances, especially even if they're local, we do offer a free discovery call, which is a 15-minute conversation that with me where I can answer some of their questions, let them know what treatments they may be candidate for. I can never say 100% without actually physically evaluating them. And ideally, we have their x-rays. So the patient can send their x-rays to our office if they have a copy. I can look at those and then I can have that information when I talk to them to let them know what treatments they may be a candidate for. So that's always nice because the biggest thing with like parents, they want to know, parents just want to know, am I making the right decision for my child? That's ultimately what it comes down to. They want to feel confident and reassured that I'm doing the best thing for my child. And then even if it's an adult too, that's for them. They like there's 100 different things they could do. They can be told different things anywhere. So they want to make sure, hey, I'm making the right decision. I'm making the right investment in my time and energy and finances. And really, I want to make sure that people want to make sure they're doing the right thing so they have the best possible opportunity to have a successful outcome and high quality of life. So when someone comes into our clinic, we always do a physical evaluation, scoliosis-specific evaluation. You make sure you're ruling out any other pathologies that could be causing. But you're seeing like where someone is at, you need to make sure you have updated imaging too. So sometimes it involves the imaging. And then from there, I'll give my recommendations, whether if they're a candidate for a custom brace or scoliosis-specific rehab or a combination of those things. Now, as far as do we do telehealth and stuff like that, we telehealth. We have people that come from other states. Generally, we're starting in our office, and then sometimes I will do telehealth checkups with them at home. I'm doing one later today with someone from like Missouri, for example, where I'll be reevaluating her scoliosis exercises, making sure she's doing it properly, looking at her posture on the outside, just to make sure we're on track. So then that way I can make the visits back to the clinic a little less frequent. Also, sometimes we have chiropractors that are pretty trained in structural mechanics of the spine, especially if I have someone that has a background in chiropractic biophysics. I can have them go there to do follow up imaging sometime to save them a trip. The only thing I have to do in my office is if I have to make modifications to a brace, I really need my workshop to do that. Also, teaching the patients the scoliosis rehab sometimes a lot of times I feel is better, at least initially, with someone hands on, because when you have someone there hands on in the beginning, it can be hard for your brain to get your body to do what the therapist is trying to get it to do. So they can passively assist you and show you initially as part of the learning process before maybe you may be able to actively get your body to do it on the own. So people sometimes, and we do intensives when someone's coming from a ways away, we'll do intensives where we'll do 2 treatments a week, and a lot of times we'll see them Monday through Friday, morning and afternoon. And as we get ramped up, we'll actually do some intensives done in group sessions where we can treat more people intensively at one time. Even though their treatments are individual, you can have different therapists doing different things at the same time. It depends, and we work to accommodate, and we know what situation someone is in and where they're at logistically. And so we think with that to make sure, one, you got to make sure you're giving them the best treatment to give them the chance to have a successful outcome. But then two, being smart and intelligent about managing the resources of both time and money properly. As far as braces go, the braces we make, they're about like braces on teeth. They're custom made. We charge 5,500 for them. It's comparable to buying braces on teeth. The only difference is, I mean, if your teeth don't look good, it's a cosmetic issue. If you don't take care of your spine, it can become life impacting from a physical standpoint and potentially to uh, an expensive surgery that could possibly have been avoided. And then our rehab is just basically like general physical therapy fees.
Okay. Amazing. All right, Dr. Chris, thank you very much for coming on and sharing your perspective and your approach. It's encouraging to see that there's people and teams such as yourself who are bringing together what's needed for an holistic approach here.
Well, thank you very much, and thanks for having me. It's my privilege to be on the Posture Dojo
Oh,
show.